I'm Dr. Donald Lloyd-Jones from Northwestern University in Chicago and the immediate past president of the American Heart Association. I'm here with Dr. Xiang Li from Tulane University, and we're going to hear about her exciting news that she just won the Jeremiah and Rose Stamler Young Investigator Award here at the American Heart Association's Epi and Lifestyle Conference in Boston. First of all, congratulations to you, Xiang.
Thank you so much.
Yeah, really wonderful study, which we're going to unpack in just a moment. So the Jeremiah and Rose Stamler Award is, again, for young investigators who really are showing us the very best in epidemiologic and prevention science. I had the privilege of working with Dr. Stamler for many years. He was the founding chair of my department at Northwestern, and unfortunately he just passed away last year at the age of 102. But no one really embodied the research, but also the life of cardiovascular health better than Dr. Stamler. He started pursuing a Mediterranean eating pattern back in the 1940s, and as I said, just passed away last year at the age of 102 while working on his R01 grant renewal. So clearly a successful story of healthy aging. And this award really, I think, memorializes the incredible work he did as one of the founding fathers of cardiovascular epidemiology and prevention, as a founding member of this council, the Council on Epidemiology and Prevention, and really a mentor to so many generations of researchers in this field. So appropriate to remember him. Now, Xiang, your work was focused on a concept that really came directly from Dr. Stamler's brain, which was this concept of cardiovascular health, that people who maintain better levels, really optimal levels, of the known traditional risk factors into midlife tend to do a whole lot better in terms of their longevity, their health span, and avoiding many chronic diseases of aging. And we've seen a growing body of research around the definition of cardiovascular health that American Heart Association has put out there. Used to be called Life's Simple 7, now called Life's Essential 8 with the recent update. Now your work started in the UK Biobank,
yes,
and applied this new Life's Essential 8 construct. Maybe you could tell people a little bit about the UK Biobank.
Okay, so UK Biobank is a large cohort built in, based in UK. So there is originally more than 500,000 participants recruited. For our analysis, we'll only include a subgroup of them because the diet is really only the 24-hour diet record is only collected among subgroup population. So in our study, we included more than 137,000 participants with all complete information from the Life's Essential 8.
And those things included the sort of 4 health behaviors: diet, physical
yes,
activity, smoking exposure, and sleep.
Yes,
the new thing,
yeah,
right?
Yeah.
Which is kind of the exciting aspect of Life Essential 8. But then also those things we measure in the office: body mass index, cholesterol, blood pressure, blood glucose. So that's what makes up the Life's Essential 8. And you also, actually, one of the strengths of the UK Biobank is they have genetic information on all these individuals. So what did you do with the genetic information?
So for the genetic, we created 2 genetic risk scores for coronary heart disease and for stroke, using the SNPs identified associated with coronary heart disease or stroke. And we analyzed whether those people predisposed to a high risk of coronary heart disease or stroke could be modified by adhering to the Life's Essential 8.
Perfect. So we've got these 2 scores. We've got the cardiovascular health score really reflecting more maybe lifestyle and lived experience. We've got the polygenic risk score for coronary heart disease and stroke, reflecting what we inherit. And what did you find in terms of the cardiovascular health scores? How are those associated with long-term risk for heart disease or stroke?
For the cardiovascular health score using the Life's Essential 8, we found that people who adherence to a higher LE8 score was associated with significantly lower risk of cardiovascular disease. That includes coronary heart disease and stroke, and also the composite outcome of cardiovascular disease. So one standard deviation that equals to 12 in the score increase in the LE8 is associated with 29% lower risk of developing coronary heart disease. And also similar association was also found for stroke and total CVD. For when we comparing the low, moderate, or high CVH levels, we found that people who were in the high CVH category, they were associated with a hazard ratio of 0.34 for developing coronary heart disease.
So a 66% lower risk for coronary heart disease if you had high cardiovascular health compared with low cardiovascular
Right,
health.
and it's almost 50% lower risk of developing coronary heart disease if you are in the moderate CVH level.
Yeah, so each step matters a lot.
Yeah.
Really interesting work. So that was the overall, that sort of 66% reduction for high versus low, the 29% reduction for each 12-point difference, right? But did you find differences between men and women?
Yes, we do find a difference between men and women. The protective association between LE8 and the association of CHD, stroke, and CVD is much stronger among women participants.
Yeah, really interesting finding. And also by age, I remember.
Yes, and this association is stronger among younger adulthoods compared to the older adulthood.
Yeah, which kind of fits with some of the literature where we've seen that, improving your cardiovascular health is always a good thing to do, but the earlier you do that, the better, right?
Yes.
The earlier you have high cardiovascular health, the better it's going to serve you.
Right.
Yeah. So one thing that I thought was really interesting that you did was you compared the new Life's Essential 8 score to the old Life Simple 7 score. And what did you find in terms of the performance?
We really find exciting news that LE8 outperforms LS7 in predicting CHD, stroke, and CVD. This is because so we use heresy statistics. The LE8 generated a higher heresy statistics compared to LS7, and this means LE8 is more accurate and better in the predictive ability for CHD, stroke, and CVD. So this improved performance could be attributed to its inclusion of more relevant risk factors for the disease outcome, and also could be attributed to its more sophisticated algorithm. And which are both true for the LE8, as we include the sleep health as a new component, improved several individual metrics, and also incorporate a more continuous, sophisticated scoring algorithm.
Yeah, so as you said, we've got not just the original 7, we've added sleep, which was independently associated, that you saw in your work. But also, that new scoring system really gets, I think, more granular. You can put people in more appropriate levels of cardiovascular health than with the old score, and maybe that's why it did better.
Right. So it has a better ability to differentiate people, like who will or will not develop the disease.
Exactly. Okay, so this is where I think it gets really exciting. So we've got the cardiovascular health score. The polygenic risk scores also predict the risk for these outcomes, of course, as they should. Mm-hmm. What happened when you put those things together?
Yeah. So in our joint analysis, we see that compared to people who have a high genetic risk and a low CVH, those who has a lower genetic risk score and who adherence to a high CVH, they had a 79% lower risk of developing coronary heart disease.
So that's quite striking. Let's unpack that for a second. So bad genes, but good lifestyle, 79% lower risk than people with good genes, but bad lifestyle. I mean, that's a pretty striking statement.
Right, so that means gene is not destiny. We can really modify it and reverse the gene predisposition.
Yeah, I think that's a really hopeful message, for our listeners is if you've got people with a strong family history of cardiovascular disease, what it's saying is that if you focus on their cardiovascular health and really try to improve that, you can trump an awful lot of that genetic risk. Really powerful and hopeful message. Terrific.
Yeah.
Anything else you want to tell us about your research?
We actually also look at the separate associations of health behaviors and health factors. I got a comment during the presentation. It's really helpful, and he was saying that the health factors could be the mediating effect of the health behaviors with cardiovascular disease, and I totally agree with it, because these 8 components were not separately work individually. They really could affect each other in a more synergic way.
I think that's right. I think, most of the research on cardiovascular health today suggests to us that the package is what's important. Each of these things does have independent contributions, but really that synergy of having better levels of all these things is what makes it so powerful. Yeah. Well, Xiang, I want to congratulate you again on your wonderful win for the Jeremiah Stamler and Rose Stamler Young Investigator Award. Really, really beautiful research.
Thank you.
It's such a pleasure to kind of amplify the research of exciting young investigators. Certainly wish you all the best, and
Thank you so much.
Please continue your great work.
Will be. will do.
Terrific. So from Boston here with Dr. Xiang Li, celebrating again her win of the Jeremiah and Rose Stamler Young Investigator Award. I'm Don Lloyd-Jones from the American Heart Association. Have a great day.